Roberto, how long have you been using the LiveWave technology?
I started using the patches in October last year.
Okay. And was it a close friend that introduced you to the patches, or how did you come to even find out about them?
A friend of our family started invited us to use the patches, and I am very thankful that not only was she using the patches at the time, but now she convinced us to use the patches ourselves.
Wonderful. I tell you, once you understand how they work, we want to convince everyone, don't we?
Yes. I tell you, since I was convinced of using the patches, of course, we started sharing it with our friends and our family members, etc.
And so I remember when we first talked, I was shocked by your story. And I understand that you have been on dialysis since you were 16. Can you tell us what happened between 16 and 17? And then share with us some other struggles you've had over this long duration of your life, and just what that looked like. Give us about 3 minutes of what it looked like to live as you did.
Okay. They tell me that at the age of 16, I went to one of the local clinics, and what they told me was that unfortunately my kidneys had gone bad because of high blood pressure, that it ruined my nephrons, and as such I had to immediately I had to go to the hospital. My blood pressure was so high, I had a really very high headache, basically, and I couldn't walk too much because of the pain, and so they had to take me to emergency room at the hospital, and there they did a diagnosis of not only blood work and things, and they told me again that my kidneys had gone bad, and as such I needed to have immediate dialysis. And I started at the age of 16 with a catheterization down my groin, and that's where they dialyzed me for 5 hours the first time, and that was my 10th grade in high school.
Okay, so I would think that over the last, how long have you been on dialysis? Around 42 years?
In April 27 is going to be 43 years.
Okay. In that time frame, I would say that dialysis might have changed, and in the last over 40 years, or has it?
Yes. Oh, yes, it has. I was telling them that I have seen a change not only in the machines that they use, but also in the artificial kidneys have changed over time. It used to be like a big washer, like a washing machine. Nowadays, they use a small, what it looks like, it's a small filter, basically about this high. I don't know if you can see me, about this high, and about 3 inches around. And that's what the filters today. It used to be, like I said, like a washing machine. But over time, yes, over time it has changed.
Like the microwaves were real big, the TVs were real big. That's all they knew how to do.
Yes, exactly.
So what was your life like? Can you give us some, usually we have a bullet point. So it's this and this and this and this and this.
Sure.
Could you perhaps give us a bullet point over the last 40 something years? Even if some of those have not changed yet, it's up to you. But
okay.
A snapshot of what life was before, then we'll do a snapshot of what life is like now.
One of the first things that immediately noticed was anemia, deep anemia, from a man, usually hemoglobin from 12, 13 to around 8. And so I couldn't function. I was very anemic, high blood pressure. I couldn't go to school. I was in the hospital for a month. And of course, I stopped going to my 10th grade. And by the time I came back to high school, it was at the time when about 3 months later, when everything had been taken care of as far as being on dialysis for a while, and I could function again. Before I was a soccer player. I stopped being a soccer player for a little while I was adjusting to dialysis. And then, of course, my energy came back once I started doing dialysis. So
Dialysis is basically keeping your kidneys functioning normal.
well, what it takes the place of my kidneys because my kidneys stopped working. And
Okay.
so the artificial kidney clean my blood, not only take away toxins and waste products, but also extra liquid. Because again, the kidneys completely stop working. They don't do their function, so the machine takes the place.
So you have an actual artificial kidney in your body, or when you go to dialysis, that's your artificial kidney?
No, so I go to a central unit. Now back then, again, dialysis modes have changed over time. So the way the form has dialysis has changed over time. But for me, it hasn't. I found that hemodialysis is the best form for me. There is dialysis that's done with the membrane inside your stomach. Well, it's not inside the stomach; it's surrounding the intestines and the stomach, and it's called the. There's a membrane. I can't remember the name of the membrane, but there's a form of dialysis that is done that way, and needless to say, for me, hemodialysis has been the one that worked for me. I go to a clinic 3 times a week. I dialyze for 4 hours, and then I go home and rest.
So you do this, you've done this 3 times a week since you were a child?
Since I was 16, yes.
Okay, so now tell us what has changed. So you, I know the beginning part, but go ahead and explain that. But then over a year, I know you've seen some change. So what happened, like day 2, day 3, you know, whatever, however you want to explain it. And then I do want to briefly touch on the patches you used. I know that this is primarily only at X39, but in Roberto's case, because he's had such an extreme case, he did something outside of the norm to help himself, because he has lived a long time this way, and he just wanted to go for it.
Yes. So I decided to use other patches for my treatment to see what changes I could see quickly. And of course, I've seen some changes in my body quickly. Some of the changes that I've seen one is my hair is black. He stopped showing up gray or white, but now he's black and he stopped falling down. The second one is my skin is light brown. It used to be darker brown because of the toxins. The third one was the second day I started using the X39, I immediately noticed energy. And that one is probably the biggest one I've seen so far. Energy that to the point that I, can walk more. I'm able to go to the garden and water my plants. Okay, I recover faster after I get tired. Another thing that has happened in the last, well, maybe 3rd or 4th month, and which I didn't expect, is that my nephrons, at least some of my nephrons, have started producing some urine. And since I've started, I go to the bathroom and I can squirt urine.
That is medically, from what I understand, that's almost an impossibility because of the condition of your body over a long time, right?
That is precisely the point.
Give me 5 things that your life was like before the patches, if there are that many, and then the 5 things that are different now, just in bullet points.
So my energy was so low, high blood pressure, my hair was falling off, my skin was, my toxins was coming out of my skin. Okay?
What was coming out?
The toxins, waste products.
When you were before the patches, or
before the patches?
You literally were exuding toxins out of your body.
Yes.
Because there was no place for them to go because your body wasn't cleaning them.
Yeah, correct.
Got it. Okay, keep going. Yeah.
And of course, the last one was that, you know, I've seen changes in my eyes now.
Mm.
Okay, so now I can see even better. Sometimes I see better without my glasses, than with my glasses. Okay, so that's been a change that now is like, wow. Okay, now I'm wearing my glasses right now, so that's to be able to read certain things. But again, I had carpal tunnel. Uh, from a pain of 7, now it's a pain of 2 with the
Wow.
X39. So that's issues that now lately I have seen that my skin in my hands is getting a little bit better, but I want to see it get better as time goes on. My nails were getting brittle. Now they're coming thicker, but I want to be able to see it a little longer and see what the change is going to be in a couple of months using the X39. And by the way, so you mentioned that I've used other patches.
Mm.
So I used the X39 for sure, the X49, the glutathione, and the carnosine patches. Okay, now I don't recommend everybody to use them that way, of course, but in my case, I decided to be able to repair faster because for 43 years I wasn't. Now I am.